Why is anti-seizure medication half-life important? Imagine trying to keep a delicate balance in your body. The half-life of an anti-seizure medication is like the clock that tells us how long that medication stays active in your system. It's a key piece of the puzzle when managing epilepsy because it influences how often you need to take your medicine and how stable your blood levels stay. The half-life is the time it takes for half of the medication to be eliminated from your bloodstream. If a medication has a short half-life, it leaves your body quickly, so you might need to take it more often, maybe 2 or 3 times a day. This helps keep the medication levels steady, reducing the chance of breakthrough seizures. But if you miss a dose, the levels can drop fast, which might increase seizure risk. On the other hand, medications with a long half-life stay in your body longer. This means you can often take them less frequently, maybe once a day or even every other day. Less frequent dosing can make it easier to stick to your treatment plan and helps keep your blood levels stable over time. When levels are stable, it's less likely you'll experience sudden seizures or side effects caused by fluctuating medication levels. The half-life also plays a role when starting a new medication or changing doses. It usually takes about 5 times the half-life for the medication to reach a steady level in your body. For example, if a drug has a 24-hour half-life, it will take around 5 days for your body to fully adjust to the new dose. This means that any changes in seizure control or side effects might not be immediately noticeable, so patience and regular monitoring are important. Side effects are another aspect affected by half-life. Drugs with a short half-life can cause side effects to appear and disappear quickly, which can be helpful if you need to stop a medication due to side effects. Conversely, medications with a long half-life may cause side effects that linger even after stopping the drug because it stays in your system longer. This is why healthcare providers carefully consider the half-life when switching medications or managing side effects. Understanding the half-life helps doctors personalize treatment. Everyone's body processes medications differently based on age, other health conditions, and other medicines they take. Knowing the half-life allows healthcare providers to adjust doses accurately, aiming for the best seizure control with the fewest side effects. In summary, the half-life of an anti-seizure medication is vital because it influences how often you need to take your medicine, how quickly it starts working, how long it takes to see changes after adjusting doses, and how side effects are managed. This knowledge helps ensure that epilepsy treatment is safe, effective, and tailored to each person's needs. Always remember to follow your healthcare provider's advice and discuss any questions about your medication.